How's everyone doing? Surush Gul here from Event Combo. Great to be with all of you today. Wanted to welcome our chief guest for this Life After the Jab session, Dr. Vin Gupta, who I believe right now is streaming from California. Dr. Gupta is basically a key stakeholder in the voice and the communication around the vaccination rollout that's happening in the United States. And he's been on MSNBC. He's a contributor on MSNBC, and he's currently also a professor at the University of Washington. And he consults with athletes in Major League Baseball. He consults for Amazon Web Services, AWS, and their employees around safety, among many other events and organizations throughout the United States. And today we wanted to have Dr. Gupta on specifically to discuss discourse around the vaccination rollout and the concerns that have arose due to its mass scale concern. So, Dr. Gupta, with that said, welcome. Thank you again for joining us. Dr.
Thanks
Gupta,
for having me.
absolutely. The first question I guess that comes to mind is, based on what you've seen since President Biden's been in office, what are some of the positive aspects of the vaccination rollout and some of the areas of improvement?
Thank you for the invitation to be here and to help hopefully add to the dialogue on how events can happen safely in person, because I believe they can. To answer your question, a lot's going well right now, and there's a lot that isn't under the control of the government that could be optimized, and I'll get into that in a moment. But I think what's going well is the fact that every day we were having about anywhere between 3 to 4 million vaccines going into arms. And that is no small task. That requires, a communications operation that has improved. I think the messaging has dramatically improved in just the last few months on why one should get the vaccine to keep you out of the hospital. That's the top line statement we should all be repeating to everybody, that there's no other purpose for vaccination. And then in terms of just allocating product, so vaccine supply to state and local health agencies, who then will allocate it to vaccine clinics in their jurisdictions, that process has become more seamless. And frankly, the bumps in the road that we saw in late December, early January were to be expected, regardless of who was in power. This is something that we're not used to, mass vaccination at scale, especially when we're dealing with vaccines that require special handling. And so some of those troubles were going to be smoothed out inevitably. So there's a lot that's going well. What's not going as well, of course, is this race against the variants and what we're seeing happening in other parts of the world. And I think one thing that sometimes all of us here in the States might lose sight of is what happens globally is ultimately going to impact us locally. And so the fact that India and Brazil, France, Italy, parts of Canada are going through a very significant surge should concern us all. That until their populations are vaccinated and protected, we're really not going to totally be out of this. Our new normal come July 1 is still not going to feel like November of 2019 before this all started. We're going to have limitations on where we're recommended to travel. There probably will still be some degree of mitigation efforts in place, like distancing and masking to some degree. And I can talk about that more, but there's going to be a new normal here. It's not going to fully feel like normal. And part of the reason why is the global situation is a lot different from the local situation.
Sure. Thanks for that context, Dr. Gupta. What's going to be the social construct for a post-vaccine world? For example, to give you a specific concern, you have a number of individuals that are vaccinated at a workplace or at an event, and then you also have a number of individuals that are not vaccinated. So how do you manage that from a health and safety and also a social perspective, right?
And this is where I think every organization and every event planning organization specifically has some ability to do things that the government, for example, is saying that they're not going to do, which is either mandate vaccines or mandate the imposition of passports to participate in normal everyday life. I advise or am employed by organizations where these issues are top of mind to make sure that operations are efficient and that we can get, for example, people in the seats of stadiums. So how do we restart professional sports teams and their operations safely, but also in a way that is pragmatic? You can implement the most stringent rules for infection control and workplace health and safety, but it's going to be impossible to adhere to. It's not going to be pragmatic. It's actually going to cause a lot more cost and loss of efficiency. And it's going to cause a lot of small businesses, for example, to say, you know what, we have to just close up shop. So how do you, as if for all those out there that are listening in on this, I'd strongly encourage organizations to look closely at the concept of the vaccine passport, which I think has become needlessly politicized and toxic in the public domain, the discourse around it. Whereas in reality, we basically do something like this anyway with when having to demonstrate proof of vaccination for other types of pathogens, whether it's meningococcal pneumonia, before you go to college. You know, most colleges actually mandate a slate of vaccines. What's different here? Right. Functionally, what's different? As long as you have access to the vaccine, if you want it, and hopefully you do, it doesn't seem unreasonable to me in the setting of a once-in-a-century pandemic to mandate demonstration of a vaccine through a vaccine passport, some platform that you trust, or if for those who don't want to get the vaccine, a negative test within the last 24 hours. Either or seems like that is table stakes now to enter and participate either in a conference, an in-person event of any type, or if you want to go out to a restaurant, or if you want to go out to the ballpark, fly to a vacation. This needs to be the norm because it's going to provide a critical incentive for those who are holding out on getting the vaccine to say, you know what, let me just get it. 80% of the country has already gotten it. Let me just go ahead and get the jab because it's going to make my life a lot easier when I want to do these things.
Right. No, absolutely. So, Dr. Gupta, you just brought up a good point and this is why we wanted to have you on and speak on these topics is what are some measures that can be implemented from a organizational standpoint that's executing an event to promote vaccination and safety and diffuse the misinformation out there?
I think one strategy here is that as you're getting individuals to register, part of the marketing materials for whatever it may be, whether a medical conference or a conference of any type, other types of events, that making it clear that the COVID-19 safety protocol measures that are going to be put in place will either mandate showing a vaccine through some sort of technology that the technologies are being built as we speak. IBM is building an interesting technology. Microsoft, a million and one technology platforms will exist that will sync with state and local databases. So while protecting the individual's private medical information, that will allow people to feel some level of comfort that, okay, somebody's showing me this vaccine passport on their smartphone. That's not fraud. That's legit.
Right.
And to me, that should be a part of marketing materials for conferences. And then also having on site some third-party testing vendor that can implement high-quality rapid testing, where if you're not going to have a vaccine passport, and then say the color of the badge for the individual reflects, maybe it's a green for this individual is vaccinated, and maybe it's yellow for individuals that need to test. If it's a multi-day event, they need to test every single day that they're actually entering the conference or the event's grounds. There has to be a way to make it, or you can fob in and into an event, and you're good to go if you fob in and the door opens, and if not, if you have to be redirected to a testing area before you're allowed to enter, then that's the table stakes to enter now. There's ways to do it. The tech's actually not that hard to do, but that to me should be ground rules for any of these events, and we should not allow for the individual who has not been vaccinated or who's unwilling to consent to daily testing with a rapid testing platform, they're not allowed to come. They have to stay in a virtual environment. And so to me, that keeps it safe. That keeps the event off front page headline news. I've seen close colleagues of mine put on in-person events and have those events turn into spreaders of COVID. And it's not a good look, especially if you're in the healthcare. It's not a good look for anybody, but especially if you're trying to put on an event where, you're discussing healthcare related issues, it's not a good look. And so that I think being strong up front in who can and cannot actually enter the premises is going to be really important. And then it allows you to actually move away, in my view, from strict distancing guidelines. So you don't necessarily need to feel obligated to do the 3 feet of social distancing, which is really hard to do in practice. Obviously, people are going to mask as they need to. One can make the argument that if you have a vaccine bubble type event, you don't actually need to mask. You don't need to mandate masking necessarily. And if we're talking about timing, and if this is a July 15th onwards, there's an argument to be made here that what is the point of masking at that point when hopefully we've reached herd immunity as a country? I think these are going to be the questions we have to wrestle with. It's not going to be black and white. But mitigation measures on site, distancing, requirements on masking, hand hygiene, they become a lot easier if you create a vaccine bubble. And I would urge everybody planning events to basically mandate that in some fashion, because you have the ability to do that, especially as the Moderna and Pfizer vaccines go on to full FDA approval.
So I think our organizer community also certainly will be excited to hear this. I think some of the points you mentioned are completely practical. Just a couple of other points, Dr. Gupta, before we progress. With virtual events, it is a concern that, yes, as an organization, we can do an event that has an in-person component, but we can also have a virtual component. How do you address that concern, obviously related to safety? How do you address that concern that, hey, you know what? Even though your attendees, or a good number of your attendees are virtual, that doesn't necessarily mean that it's a bad thing for human connection and engagement, right? So what's some of the messaging that we can speak to with our clients, with our event organizing partners, to alleviate that concern of, hey, if I do a virtual event, I'm going to alienate my partners and my attendees? I mean, how would you address that?
I think one message here would be to say that renormalizing life, and with that comes in-person events and conferences. That's going to be a gradual transition, and in some cases, hybrid events to me represents a great middle ground where you have an in-person component for those who want to make the trip, but that you allow for virtual, so that you account for the fact that some people are still not going to be comfortable hopping on a flight, and that there's going to be some dipping of toes in the water, so to speak, initially before really jumping in. And so, talking about that phase transition to resuming business travel, resuming travel for events, to me, that's what I would really key in on. That even if people would be fine participating in in-person interaction in a vaccine bubble, getting to these events in some cases might require travel. And a lot of people right now still are not comfortable with that. And so this whole push towards renormalization, whether it's in the workplace or for events, has to be phased, has to be gradual, so that we meet people where they are.
The last point I wanted to bring up was predictability. What's Dr. Vin Gupta's prediction on when we'll start seeing herd immunity, and when you think, quote unquote, and I know the world is never going to be normal again, but when do you think this new normal will start being accepted?
Yeah, it's a tough question. So sure. I guess what I'd say here is that we're expecting at the national level, and forecasts from IHME and others here at the University of Washington suggest that by the end of June, hospitalizations and deaths from COVID will really be at an all-time low for the pandemic. And I think that's going to be the key metric that we should all look at. To what degree are our health systems really stressed or not stressed because of this virus? And that's going to be what should be guiding reopening strategies, sort of maybe the 7-day trailing average of new hospitalizations in your specific zip code. I think that's probably going to be a different conversation based on the zip code. And so you might see certain regions of the country adopt a more aggressive posture towards reopening than others. Certain regions, certain governors have said they're not going to accept vaccine passports or not going to push for it, or it might actively pose obstacles towards the adoption of them. So it's going to be a regional. This is not going to be the light switches on July 4th and the country opens up. I do think there's going to be different approaches state by state or region by region. But I do expect that there's going to be a switch in mindset across all 50 states to some degree by the end of June. I would expect that events in person should be able to proceed with the right policies in place. I mean, this is going to require a lot of pre-planning, but by middle July, to me, seems a very reasonable expectation. And that's effectively herd immunity. The point at which we've reached enough vaccination so that hospitalizations remain low.
Thanks, Dr. Gupta. So with this, Dr. Gupta, we're going to open up the panel. We're going to invite Dr. Rajvi Vora. Hi, Dr. Vora. How are you?
Hello.
All right.
Good.
So Dr. Vora is Assistant Professor of Psychiatry and Vice Chair of Clinical Affairs and Behavioral Health at Mount Sinai Hospital in New York. And Dr. Vora, thank you so much for joining us today. Dr. Vora, what have you observed in the last 15, 16 months? How have social problems evolved or devolved?
I think people are talking about the second pandemic, which is the mental health pandemic, which is really overtaking America right now. I think the last 15, 16 months have been clearly not normal, but the actual impact that it has had on so many people, families and jobs and lifestyles completely. We're not just talking about the people that got sick and died. I mean, that was a big component of it, but everybody else and the aftermath of it has not been pleasant, of course. Everybody from healthcare workers to the layperson has been affected. Anxiety, depression, PTSD have been on an all-time high. The demand for psychiatric services has skyrocketed. There's just not enough of us to keep taking care of the people. There's this whole new idea, we're talking about long haulers of COVID. I think there is a whole long haulers for mental health effects of COVID that has also sort of been thrown out there because it's been a pretty rough year for most people. Talking about isolation, having anxiety, people that have anxiety in general, OCD in general, the idea of anything you touch, anyone that you come in contact with is going to kill you. I mean, that has been pretty life-shattering for a lot of people. So this has been a really rough year for most psychiatric patients, but even for people that never had an issue with it. Yeah.
Sure. With the amount of isolation and quarantine that's happened over the last year plus, has there been an increase in heart attacks or diseases related to lack of physical activity? Have you observed anything like that, Dr. Vora? And Dr. Gupta, if you've also heard anything about that, that'll be interesting.
Yeah, diseases have happened. It's not like everything else went away. In fact, JAMA just came out with the top 10 causes of death this year, and heart disease and cancer were still number 1 and number 2. In fact, heart disease took a little bit of an uptick in the total number of deaths, because again, these issues were existing, and everybody was so focused on COVID. I know that a peak of the pandemic in New York City, even in March and April, it was pretty bad. I mean, we were hearing of cases that EMT, the ambulance drivers were not even going to bring the patient to the hospital because there were no beds and patients were just dying from cardiac arrest. And we don't even have a count of it. So 100% that other illnesses took over. People lost their regular primary care checks. And that did lead to an increase in other medical issues. Dr. Gupta.
Yeah. Good.
No, I couldn't agree more with Dr. Vora and her comments. I do think what I've noticed, at least as we've been trying to plan for a safe return to either offices and corporate settings or what have you, restarting conferences, that there is, and Dr. Vora is of course more expert in this than I, but there does seem like there is this undercurrent of undiagnosed social anxiety in individuals that would prefer to stay in a remote setting, and supporting them and making sure that we're meeting them where they are think it's going to be a really important part of normalization. So making sure it's gradual and phased and not, black and white. Tomorrow you need to show up or you need to fly for this conference, that we do have a phased reentry.
Another question, just piggybacking on this, right? So one of the concerns that has been boiling up is, okay, we've got this vaccination rollout. I'm going to consider getting the vaccination. Then all of a sudden, you hear what happened with the Johnson & Johnson vaccine, right? Where blood clotting and folks that were already afraid or had anxiety for taking vaccination, then have their anxiety validated with the fact that, we know what happened with the Johnson & Johnson vaccine. How do you address that, Dr. Vohra, from a, psychological standpoint, right? How do you ease concerns?
So, the whole idea of data and statistics in today's world is so different than anything that we've ever known, right? Like, how many of us knew what percentage of flu vaccinations are protective? Do we know the names of the companies that our flu vaccines come from? Or like Dr. Gupta said before, the meningococcal vaccine that we need to take before we go to, colleges and universities. We didn't know these things. It's just the social media and the heightened scrutiny of all of this that has sort of brought some of those things into major media outlets, right? But if you think about the risk of a vaccine, so the number by itself, like 6 cases for over like 1.9 million doses that were administered, that is so tiny. What is the risk of like getting in a car and driving right now?
Right.
Probably higher, right? About 100 people today die of car crashes every day. But if you go by the federal data for vaccinations, 0 to maybe 1 vaccinated person would die of COVID, right? So how do you balance the risk? Everything in medicine is risks and benefits. Aspirin, Motrin has risks. If you look at that, I think they're probably higher in terms of their blood abnormality, the side effects that they have. Nobody talks about that. Mm-hmm. So I think the idea of like trying to support people and helping them understand that, it's going to take some time, but again, we're blowing things up where they don't need to be. And just if data is what you're looking at, then look at all the data, not just this.
Sure. Folks are saying that, you have to, the vaccine doesn't work. You have to keep getting vaccinated. How do you dispel comments like that? Obviously you use facts, but I just want to remind everyone, and I would love for both of you to speak on this. How do you kind of educate the public to let them know, hey, it's okay, you need a booster. Why do you need a booster? If you can speak on that, Dr. Vohra, and then Dr. Gupta, would love your comments as well.
I think vaccinations by themselves are controversial. We know that even before COVID, there's a whole community of people that doesn't believe in vaccines. And I think there's some people that will never, but we don't have measles anymore unless, you probably are not vaccinating your child, right? And there are boosters that are required at a certain point. And look at the flu vaccine. Again, I bring that up because every year there's a new strain of flu. And every year we all go back and get our flu shots. And it's pretty much the same thing. This is a virus that can mutate. And so is the vaccine working? Yeah, because we have data that shows that people are not dying anymore. So are you doing okay by going back and getting yourself protected again for a new strain that might come up? Sure. So I think normalizing is the biggest thing that we need to do, because I think right now the heightened sort of fear and the paranoia, which is, again, understandable because we're coming from a year of paranoia. Like anything and everything that you did was like, you're going to die. You were like literally hiding in a little closet, not getting out of your house. So that can do a number on your rational thinking and like really increase paranoia for everything. Not trusting a lot of the information coming out because, again, we know that like that happened all through the year. There were things that we didn't trust. So I think normalizing and really comparing this much more to something like the flu vaccine, that it's an agent to help us not get really bad flu. It's not curing something. It's not going to eliminate. We're never going to have zero COVID. But the whole idea is to bring it to the point where COVID is going to be no bigger threat to you than a car trip or a common cold. So just really, I think normalizing is the biggest thing to do.
I think it's too soon to tell, and which is why the reaction to the Pfizer CEO's comments recently were met with some disbelief in public health communities across the country, where all we know is that at 6 months after you get that specific vaccine, the antibody levels are still extremely high, suggesting that at least at a year, hopefully, they will remain still high enough. And who knows how long they will remain high enough to still provide you protection. So that's one. We don't know what we don't know.
Sure.
And I think it was premature for him to put that information out there. And we also know the vaccines, as they exist right now, still protect you from hospitalization, regardless of the variant in question. So hopefully that remains true. And if the two remain true, then it's too early to speculate on the need for boosters. It's good that they're planning for it as a contingency. And I think that should be the message. If you need it, we'll have it. But to come out there and say, in 12 months, you're rolling up your sleeve again, for sure. If anything, I think that just gives fodder to those who are hesitant or conspiracy theorists who think that this is all some grand plan on behalf of pharmaceutical companies. It actually does bolster their claims that, look, well, this doesn't make any sense. And they would be right. It doesn't make sense right now to be talking about boosters in an intentional way, but in a more of a conditional, let's plan for the unexpected.
Yep. Thanks for that, Dr. Gupta. To kind of bring it home, a couple of more points. From your perspective, I want to bring in the psychological aspect of it. Anxiety, right? There's an event coming up I really want to attend, and I'm super anxious because I'm going to be in the same venue as thousands of other people. Some of them might very well be having be infected with COVID. What are some best practices from your standpoint, from a psychological approach that organizations can consider to remediate some of these concerns and to ease some of these concerns for their attendees?
I think organizations need to really highlight all of the safety stuff, right? I think kind of like the airlines or like a hospital, wherever you go, there are signs everywhere, there are hand sanitizers everywhere, making sure that there's actual commitment to ensuring the best practices, making sure people are actually masking, because again, a lot of this is going to be very gradual and phased in reopening of everything as we are talking, right? So I think organizations really need to be very mindful of how they open up the event, having, I think, extra people, a manpower to sort of monitor some of this, right? I think would make people feel a little bit more comfortable, because you can be, if people that have started traveling talk about how at the airports there are people that are, they have the mask under their noses. And it's, again, the irrational fear of even after you're vaccinated, can I still get it? That anxiety is still going to always be there. So even if we have the technological sort of I like the idea that Dr. Gupta brought up of having a green, yellow sort of who needs what. Maybe having I don't know, a display of that saying that there's X number of vaccinated people, or people have been tested, clear visible signs. I think all of that makes people feel a little more comfortable. But I think a lot of this is going to be really internal, right? I think any of us could feel similar anxiety stepping into a big crowd after not having been in some places for so long.
Right.
So I think teaching people how to manage some of that, naming your anxiety, I think is a very important, there's a lot of studies that show that if you name your emotions, you kind of allow them to, you can feel anxious, but you can also say, I'm excited, but I'm also a little nervous. So I think you label your feeling, you label your emotion, and that can help you process some of what you're doing. So if you can say, I have butterflies in my stomach, but okay, that's like a job interview. You can have good butterflies,
right?
And that's okay.
Yeah. Right? Yeah. Thanks, Dr. Bora. As you were saying that, I just visualized at an event, the initial, events have icebreakers, but I just visualized a mass scale icebreaker where the organization is having their attendees, discuss their anxiety or maybe articulate it in some manner to kind of ease the attendance. The last thing I wanted to just ask both of you was, 2 years from now, 3 years from now, 2024, 2025, what do you think that world is going to look like in terms of, is it going to be 100% back in person? Or do you think that it's going to be 50% virtual, 50% in person, hybrid? Or do you think that it's still going to be 70, 80, 90% virtual?
I think we're going to go back to more in person. I think we are social beings. I think we need the human connection. I think we need to see people in person. I think the virtual world is here to stay. It's not going away anywhere. And I think there will be a certain percentage of people that will always have that option. And I think it's a good option to have, right? Where like Dr. Gupta is in California, I'm here in New York, and we're still able to sort of have this event. So I think that will always be great. But I don't see us being mostly virtual because I think there is something about the human connection that we've all missed in this last year. And so I think we will want to go back to that.
Thank you for that, Dr. Vora. I really appreciate it. Dr. Gupta, please.
I'll just add, I agree with Dr. Vora and her comments. I do think that the ability to be virtual and have flexibility is a key part of recruitment. And at least from what I'm hearing from some of the organizations I'm a part of, and that it's attractive, and that to keep talent, recruit talent, and this is spans different sectors, private, public, you name it, to allow individuals to work from home a few days a week or to Zoom in for a conference. It's actually increases productivity in my view. I mean, I personally found that I can do fulfill 3 to 4 different roles between 8 and 5 a lot more easily if I can just do it from the comfort of my home than having to walk from point A to point B or hop on a plane. So this, to me, I think we're going to recognize that this is a key part of recruitment, talent retention, and then also just productivity in some cases.
I agree with both of you. I think that there's value in virtual. I'm in the same boat. Our team, became distributed after COVID, and we've seen the productivity value there. And Dr. Vora, I agree with you as well. I think that people are craving in person. And I've always said, when in person comes back, it's going to come back really powerfully with a virtual component to it, because now we're all digital. As I say, we're all digitally spoiled. And I think we're going to enjoy both. Dr. Gupta, thank you so much for joining us today. Dr. Vora, thank you so much for joining us today. It was a pleasure hosting both of you, and I look forward to many, many more interactions with you. Thank you again. Thank you.
Thank you.
Thank you. Bye-bye. Thanks for having me.